Hi, I'm Jason Mizell. I'm a colorectal surgeon at the Baptist Health Medical Center here in Little Rock, Arkansas. So when I started college, I was planning to actually go into seminary and be a preacher. But whenever I went through college, I liked biology, continued to study that, and began to feel God's calling actually to go into medicine. So I took the MCAT and did well on it, and I felt like that was God's calling to lead me over to medical school. So I went that route, and then about halfway through medical school, really felt like my gifts would best served in the area of surgery. So that's ultimately how I landed here. So now I use my surgery gifts to continue to minister to people, but in a way that I did not think what I was going to do when I started college, but it's still where my heart is and where God uses me. So at Louisiana Tech for undergraduate in Ruston, Louisiana, and then went to LSU for medical school in Shreveport. Stayed there to do my general surgery training at LSU, and then went to Baylor in Dallas to do my colorectal training, and then was recruited to Little Rock and have been here ever since. As a colorectal surgeon, it sounds fairly limited, but we actually take care of quite a bit of diseases. Most commonly in my practice, I do a lot of colon and rectal cancer, but we also do a lot of benign disease, diverticulitis, hemorrhoids, vague abdominal pain. We also do a lot of screening for cancer. We do colonoscopies, different things to try to help make sure that patients have preventative health rather than treating the disease once it already happened. So quite a broad spectrum, including things like inflammatory bowel disease. We have, like I said, vague abdominal pain. We have GI bleeding, so quite broad. For me as a surgeon, the patient relationship is critical, and it's very interesting because whenever you begin to really care for people, particularly in scary times like whenever they're diagnosed with colon cancer, rectal cancer, the trust is very deep, and particularly after we operate, it is a long-standing relationship that continues to grow as I follow people after we've had surgery for colon cancer or rectal cancer. Every 3 months we continue to see each other and we get to know each other, and I know their medical history, and that continues to grow, and it's a bond because of the scary times and then walking them through those scary situations and bringing them through on the other side of it. When I started the role of surgery, one thing that I realized was that, again, some of these diseases that I treat can be very scary, and so one of my roles is to help walk patients through that scary time and just let them know that I'm going to do the very best I possibly can to walk them through this and help relieve their anxiety, relieve their fears. And I feel like that's what the ministry of Jesus is about as well. And so I often tell people, oddly enough, that I love them by cutting on them, but it's because my hands are what God has given me to try to heal them. And so it's scary, but I always pray with my patients before surgery. Because again, it can be something that's very fear-inducing. But as we walk through that, I think that there's a trust and a faith that develops between me and the patient that is very rich and very rewarding. One of the things that is great about being here at Baptist is we have oncologists, we have radiation doctors, we have MRI and specialty trained radiologists and pathologists. So whenever there is a new diagnosis of cancer, whatever that may be, we work together as a team to try to make sure that all of the experts in all the respective fields all have their input, and we work very closely with each other, and we have each other's cell phones. So never is care here isolated in a silo when it comes to these GI-related cancers. It's a very cool network of being able to work with other providers so that patients get the very best care possible.